the crazy and the wild. These are the wild tales. Real vet takes, real chaos.
Guys, welcome to Wild Tales. This is a show where we are going to be discussing the craziest, the strangest, the most unhinged stories from our careers in the veterinary field. Today, I get to be here with my fellow credential technicians, Walter, Sarah, Peter, and of course, myself, Geoffrey. This episode, we're going to talk about a few things. First and foremost, we're going to go over stories from our experience. On top of that, we're going to take some questions from the audience. And to wrap it all up, we're going to have some viral bites, maybe a couple of ours, maybe a couple of ones from the internet. It's going to be super fun. You guys excited about this?
Oh, this is awesome.
Excited.
It's like being at work.
It's like being at work. This is light work. This is light work.
Wild tales.
Peter,
Yeah.
I hear you got a really good one to get us started. Let's hear it.
Well, okay, let's talk about this. You all know that I'm dentistry specialty at this point from my field of emergency back when. But this is an interesting story. We've all been transferred cases in the past, right? And
Yeah.
just boggles up the day. Well, we get a dog that comes in, bitten on the muzzle while sticking his head through the fence. We've all seen stuff like that. So, yeah, we get it in clinic. And upon exam, we noticed that the dog is missing tooth 104. This is a canine on the right side.
That's the big one.
That's the big one, yeah. So we're doing our exam, we're doing everything. We're lacerating, fixing laceration, doing all this. And then upon CT scan, we notice that that tooth is actually displaced right up into the nasal cavity.
Wow.
So what do? Well, first you fix the lacerations, first you fix the problem, and then you have to pull it out. So what we did is we actually had the dog on the back, and then we went in with some forceps and actually just kind of slowly started to pull that tooth out, and it migrated quite well. And I don't know, is it back? Yeah, it's probably back here showing, but man, it was such an interesting case. You hear the girls in the background gasping, you hear everything going on, everyone's taking photos from behind, and just an awesome thing to see, because normally you don't see that. It was just like, we thought it was a missing tooth.
It looked like a rhinoceros.
Yes,
That's
like
what I
on
was
the
gonna
CT
say.
scan.
Exactly what
That
we were
was
thinking too.
Good God, you've got me shocked already with the first story. Oh my God.
Now, I'm sure we're gonna hear a lot more, but that's kind of just to kind of break the ice.
This is how we're starting the show off.
But here's my thing. What kind of fence was he sticking his nose through? And
You know
what was
what?
on the other side?
That's
of
the
it?
questions you ask, but I just don't know. I'm thinking it's one of those kind of like metal fences that he's sticking his head through, and I'll go, "Arr."
I mean, jeez. I
This
feel like they were.
episode sponsored by Pete's Fencing.
Honestly, talk about having a terrible neighbor. This is incredible.
Yeah,
Like,
and
what do you say to your neighbor when you get back?
here's the bill.
Unbelievable.
How much was it? Do you remember?
We were upwards, and I'm not trying to make vet meds sound expensive, because that's a whole nother conversation, because it's not,
We're not
and I
gonna
think
get
we all
that.
know that.
No.
It's not.
But you know what? Sometimes cost comes with correction. So,
Right, it's true.
So
Awesome.
we have to do that.
Absolutely incredible. Now, the patient lived, thrived, is doing well.
Absolutely fantastic. The blood work before anesthesia was absolutely phenomenal. Right into surgery. We were able to pull it out, fix the lacerations. There's just some puncture marks right along the muzzle and things like that. Nothing else was fractured. And then from there on, went home later that day. Yeah.
Sounds like a lucky
Outpatient.
dude.
Medications, some analgesics to help with some pain.
Treat him and eat him, right?
Yeah.
That's what we do. Oh my goodness.
The old treat 'em and street 'em routine,
Oh,
huh?
great. Well, all right, so our next story is going to be from one of our favorite people, Sarah, our girl. Tell us about your crazy wild tale you've got for us.
Oh my gosh. So this actually isn't my story, but it was sent to me, but it was too good to pass up. All right. So this was sent in by this practice manager. It was her first day on the job.
Oh, God.
So first day as a practice manager.
Oh, God.
anyways. That makes it just great.
I'll keep my mouth shut.
So she is her first day, and they're going through the shift, and this older gentleman, comes in, and he is just completely irate. He is yelling, he's screaming, he is so mad, and so obviously this practice manager is a little flustered. She gets him into an exam room and is of course asking, what's wrong? Walk me through it. They don't even know what's going on. They get him into the exam room, okay? And this guy had said, the week prior, so this is a week before, he had come into that clinic with a DOA guinea pig.
Which is dead on arrival.
Dead on arrival.
Yes.
Okay, the
Okay.
family guinea pig had just passed away unexpectedly, and he brought it in of course, a box, just a cardboard box, and gives it to them. They wanted to discuss body care afterwards,
Okay.
things like that. They wanted the vet clinic to
I like
take
this.
care of the cremation and
Yeah.
all that. Okay, so they go ahead and hand over the box, and a veterinary technician takes the box back to and sets it on the freezer. Y'all know what freezer I'm talking about.
The freezer.
The freezer.
The freezer.
Yes.
Okay.
No popsicles in there.
Yeah.
No food.
So they put it on top of the freezer. All right,
I
and I
see.
guess, it just kind of gets left there for a hot second. They need some labels or something, all right? So, unfortunately, UPS comes
no.
through the back door,
Oh, see where this is going.
and being the proactive people that they are, see the box that, of course, had a label to
Oh,
that
no.
family,
No.
No.
tapes up the box,
And sends it back.
and mails it back to the owner.
You can't make this stuff up.
These things happen.
So if you can imagine, a week later, whenever they get this box with a guinea pig not on ice or any sort of body preservation of any sort.
The smell alone, I could smell it right now.
That box must
rigor
have been
mortis.
saturated.
Like, did it rattle?
Oh my God. So this poor
got questions.
family had the remains of their beloved guinea pig
Got
returned
sent
to
back
them.
to them. Can you imagine
That
opening
is-
up that box?
That is diabolical.
And see, you know what? This is the worst part about me. Did they put any peanuts in the box?
Oh
Like,
my
did they
God.
cushion?
This poor
It's a great
UPS
question.
guy,
Yeah, that's.
these UPS
And
guys
the
trying
UPS
to
man
be
just as happy as
proactive.
can be.
He's like, I'm gonna get a promotion.
Here is your package.
Special delivery.
They got him on ring cam. He's all happy.
My God, honestly, mistakes were obviously made that day, and we are gonna
apologies.
move on.
I don't know how that got missed or what happened.
I am shocked.
I definitely go for the
I
X
didn't
for
think
you.
that in our field we could still be shocked because we've seen it all. Yet here comes
Oh.
Sarah and blows it right out the water.
I feel like we're gonna get shocked.
My
some more.
God. All right, well, on to our next crazy tale, and I believe it is going to be yours truly. This is a doozy, guys. I think we've all heard this story at least once or twice. However,
I don't
we
know
had a Labrador come in with a married couple. Mom and dad come in. They bring their Labrador in. And what do Labradors and Doodles come in for?
Yep.
Eating
Ingestion.
things.
They eat stuff they're not supposed to, and
Yep.
that is a very normal thing. So obviously the Labrador comes in vomiting for quite a while now, not keeping food down. We already know what time it is. At this point, we decide to do diagnostics. We take some x-rays, we do a POCUS, a point of care ultrasound, and we obviously find an obstruction in the intestines. So sweet little Tucker here decides, we need to go to surgery. In surgery, we remove the foreign body. As we do, we remove ladies' underwear. Now, again, not untypical. Our dogs love eating underwear. That's just what they do. This one got stuck. Now, you guys know, most people might not believe us. So we keep that foreign body in a baggie, right? We zip it up, we
Yep.
put it there. Some people want to take it home. I don't know why. Some people don't believe that we took it out, so we keep it. Upon handing it back to mom and dad,
Oh no.
we gave it, and the first thing mom says, "That's not my underwear."
Could you imagine the look on husband's face?
There was a look on the husband's face, but the shades of red that the woman in this story turned, the yelling that ensued,
Oh.
the
Why
inevitable.
is she embarrassed?
Oh,
I'm
not
sorry.
embarrassed. She's mad because her underwear
Oh.
is not her underwear.
And now everyone knows.
And now everyone knows. So needless to say, they got a good divorce lawyer. And I think Tucker was looking out for mom that day. So
oh no.
It's her
I-
wingman.
it's, oof, that's a wild one.
Again, as Walter does.
All right, here we go. It's coming. It's coming. It'll be.
Was it a bikini? Oh, granny panties.
Listen, there was not a lot of underwear. You
so
know,
it's
it was a very small piece of cloth. I'll say that. But enough for Baxter to get into quite a bit of trouble.
You talking like whale tailing.
Whale tailing to a whole nother level.
Gotcha.
Contrary to what people think, we don't sometimes see what the foreign body is. They think we can just magically see the shape of underwear. Like, we don't know until we take it out.
Yeah, they think we're
and
gonna-
sometimes we don't even still know.
I think we're gonna take an X-ray and they're like, that's it. No.
But if you do want your animal to get in underwear, you want them to make sure it's the lesser material.
Yeah. Ladies' underwear preferred over the boxers that most of us wear. Yeah,
Absolutely.
a lot safer.
So,
Walter, we're
wear
gonna have
thongs
you.
to save lives.
Exactly.
Oh, man.
The edible ones.
The edible ones, yes. If you're gonna wear underwear, guys, make it edible. It's a lot safer, okay?
Especially if your dog's just
Yeah.
with it.
All right, we are gonna wrap it up with a crazy wild tale from my man Walter. Walter, what do you got for us?
Oh, man. All right, we're going to bring it back on Sarah level, okay? Here we
Okay.
go. All right. We went to this conference called EVEX, right? So that's your International Emergency and Critical Care Conference. Went over, me and my friend Meredith. We were chosen from our hospital to go over. Cool experience. We met this doctor from France. Awesome guy. He's like, hey, I come over to IVEX sometimes. We built this relationship. Unfortunately, I'm a broke technician, and I was like, I couldn't just go over to France and all these other things, but she could, right? So they built this relationship. So one day he calls, right? He's like, hey, Meredith, I am coming to the States. Do you want to come? It was the summertime. Hey, I need a pet sitter for my older dog. Had a dog that was like 12 years old, right? It's like that moment of like, when is it gonna happen?
Okay.
Meredith goes over. She's like, cool. They arrange everything. She goes over, right? I get a call, like day 3 of there. She's like, Walter. I'm like, yeah. The dog was named Benson. Sweet little dog. Benson just died. I'm like, okay, I don't know why you're calling me, but you probably should call his dad who's over here in the States. She's like, okay, I'm like, hey, it happens, unfortunate situation.
Yeah.
She calls, they discuss everything, it's a sad moment. So he tells her, she know how to get on the train or whatnot, so he gives her the direction to the clinic to take the dog to put him in the freezer, right?
Yeah.
She's like, I don't know how to carry this dog on the train. So she takes her suitcase, wraps his dog in a blanket, puts it in the suitcase, and gets on the train. She gets on this train, and of course, an American from the South. She's on the train, and a guy on the train starts chatting her up. Hey, what's your name? They chit-chat. They're on a 30-minute ride. Like, they're chit-chatting, and he finds out she's from America, and he's sitting close to the door.
Oh, no.
She's sitting across with this suitcase. And she's already looking worried. Of course, his dog has this dog has died, right?
Yeah.
All of a sudden, the doors open. He grabs the suitcase and hightails it off the train.
What?
This is getting worse by the second.
Not only did this dog die, it was stolen. So now you have to call the owner and say, Benson not only died, he was stolen and I can't get your remains.
He was stolen post-mortem.
Post-mortem! Now, my question is, what did that guy, if I could be the fly,
Please.
if I could be the lining of the suitcase, if I could be the towel the dog was in, what was his face like when he opened? I got it, y'all.
Oh.
Did this change the entirety of his life? Does he think of Americans differently now?
He's never stealing again.
I
I'll tell you
hope
that
not.
right now.
So that was a call from Meredith, and just like this, I sat there.
And we never saw the suitcase again.
We never know what happened to the suitcase, the dog, or Benson.
My God.
Benson in the Samsonite is gone forever.
Benson in the Samsonite.
May he rest in peace.
May he
This
rest
is-
in luggage
Oh,
heaven.
maybe he said hi to the guinea pig.
I don't know.
Why are we using air tags?
This is exactly why we use. Yep. My dog had a fly collar, so I'm gonna go ahead and say we would have tracked him right down, guys. This
Moral
is
of this
insane.
story, don't steal.
Don't steal,
Do
guys.
not steal.
100% don't steal. You guys, again, it's hard to shock me having done this for well over 2 decades. I would like to give you guys a round of applause for being able to absolutely shock the hell out of me, because that's incredible. My God.
Great job.
Well, let's, I don't know how we're going to follow any of this up, but let's follow this up with some questions from the audience.
Let's
we
do it.
actually have somebody that has a question for us.
Hey guys, quick question. What's the weirdest thing a pet owner has ever brought into the clinic in a total panic?
A suitcase with Benson in it, believe it or not.
Good old Benson.
A guinea
Benson
pig
in the
in the
Samsonite.
box.
Oh God.
Sarah, what do you got? Like, you got anything crazy?
Decomposing. Oh, I do have actually one. Lady comes in with a bag of nothing, a bag of her dog's breath for us to test COVID.
With the breath.
With the dog's breath.
Did the dog test positive? I'm kidding. Don't answer that. Good
I don't think
Lord.
that's possible.
Oh my God. Pete, you got anything
The
crazy?
only thing I could think of is a woman comes in, dead of night, and she's got this bag of grass. And you're thinking probably the bad grass. This is real.
Is it good grass?
Oh, no,
or?
this is real grass.
Okay, yeah.
And she wants us to test it because she thinks her neighbor is poisoning her dog for barking.
A very common story. A very,
More of the story, we did not test it.
I think often, right, and I don't know about you guys because I don't have anything in particular that's crazy, but people often think that we have like this CSI like setup where we can test puke, we can test hair, we can test all these things, and they typically bring it in Tupperware, like some type of food related, and I'm, why? Do you want this back when I get done with it? No, you can keep it. Okay.
Well, aren't vet techs designed to smell different forms of diarrhea?
And we know,
we know.
we know exactly what's in it. That's 100%.
But what happens
true.
most of the time, which I'm like, you guys are gross, is that Tupperware ends up in the lounge. And like somebody's like, I'm eating lunch. I'm like, do you know what came in that Tupperware?
Oh.
Why is there a Tupperware named Tucker's poop in the?
The used butter jar
Stop!
with urine in it.
Talking to vet techs who can eat spaghetti and look at roundworms at the same time. So
I mean, it's
we're
true.
pretty
It's true.
desensitized.
We are pretty twisted.
Here's the one that was weird that was brought in, kind of off the same cup that we came in. Lady comes in, brings the dog in. She's mad. She slams her AirPod on the counter, and we're like,
Okay.
Hello.
she said, you know what the other one is?
Yep.
I'm like,
Oh.
there, in his stomach. And the coolest thing, she's like, the only thing that I'm happy about, I can play a song and you can hear it up to the thing. But it was funny. We were able to scope that AirPod out, and I was like,
and
"Are you gonna put that back in?"
I love that because we can sometimes do endoscopies and fish things out without being
That's
super
surgery.
invasive and cutting. And I think that's one of those really cool advancements that we now have in veterinary medicine.
Absolutely.
You
But
can't
yeah, I
see
wonder.
it on X-ray. Did you see it on X-ray?
Yeah, we saw it on X-ray. It was
Yeah.
a cool
Can't see
deal.
that.
It was
Yeah,
cool.
there's certain things, as you guys know, like you said, underwear fabric are more difficult to see on X-rays. All we can see is there's a bunched up clump in there. But when you get AirPods or rocks or needles,
rocks,
these sewing needles in
everything.
caps,
Oh,
you've
yeah,
seen it
rocks are
before.
fun.
They light up like a Christmas tree on X-ray, and we're like, yes,
There's the
there it
problem.
is. We fixed it. We're gonna get you on out of here and make you feel better. Last but not least, let's jump into some viral bites. Let's see what kind of videos we've got from the internet.
Oh wow.
Joph, I think it's broken again.
I remember this one. The classic Game Boy or Nintendo.
If it works, it works.
And it always fixes it.
Every single time. It doesn't matter if it's medical or not. A good,
Yes.
and it fixes it for our Nintendo Sega babies.
Unplug, blow
Sega.
first before calling the
Our
hotline.
Gen Zers don't know this.
Yeah, I think, it's something that we're gonna teach you guys, but basically if it doesn't get fixed with smacking it,
Yes.
They'd buy a new one, right?
yeah, we buy a brand new one. Yeah.
Exactly.
We put a piece of tape on it that says broken and bring it to
then
the
we
office
put
manager.
and
Yeah.
then it sits there.
We
4
don't
weeks.
know. I blew in it and it didn't work, so it must be broken for
And
good.
how often do we turn it on? Like, did you try to charge it?
Oh no.
I've
you
never
try
done that,
turning it off
Walter.
and
I
on
don't know
again?
what you're talking about.
Replace the batteries.
Did you replace the batteries? Maybe?
Let's see if we got another wild one. Let's see if we got another bite.
Excuse me, do you guys have any payment plans? Payment plans? Yeah, plan to pay your damn bill. Excuse me, that was rude. You're supposed to be a veterinary professional. And your ass is supposed to be a responsible pet owner, but you don't hear me complaining.
Oh no.
Oh my God.
Okay, let's clear the air here. Okay,
let's do
Let's clear
Pet
the air.
insurance commercial?
Listen, don't you hate when owners come in and blame you for something that they're responsible for?
We're just on the
You know,
clock.
not that we are upset, but we need you to take responsibility for your animal.
Plus, we're not ever mad about it. I mean,
We're
listen,
not-
accidents happen, people, and we get it. We're literally here to help you and your pet. Like,
Yep.
that's our
It's
job.
expensive. We know it's expensive.
It is.
But we forgot to. It's yours.
I didn't do this to your dog.
It belongs to you.
But you have to understand, we did.
It's yours.
That's why they're mad.
That's your AirPod in there.
is your
I have both
AirPod.
of mine right
I
now
got
trying not to listen.
Why are you upset? It's yours. Okay.
It's
Maybe
true.
it's too
It's
simple.
true.
It's because you won't fix it for free.
Yeah.
That's the thing.
We don't have that magic shot yet, and once we do, we're all gonna be out of business. Guys, we're gonna wrap this episode up. I just wanna say thank you so much for all of these wonderful credentialed technicians here sharing their crazy stories.
Yes,
I had a super good time with you guys. Let's see what we do next time, shall we?
Yes. Back at you.
Hey.